Well, with the number of coronavirus cases rising in India, the government has now prepared a strategy to minimize the risk at hotspots or areas where there are a cluster of cases. Now, the strategy involves early identification of cases followed by cluster isolation and containment at a war footing to avoid community transfer of COVID-19 cases. According to cluster isolation plans, a 3-kilometer containment zone would be created around the house of a COVID-19 patient. All the residents in the 3-kilometer containment zone will be asked to stay indoors and sanitation of the entire area will be carried out. The health workers will also conduct door-to-door health checks to identify anyone who may have contracted the disease. Such checks would be conducted daily to avoid any community transfer. In case that there are a more number of cases, the containment area would be extended. Health workers would also maintain a list of all residents in the area, follow up with active patients, monitor residents for any symptoms and provide swift health care to anyone who might develop symptoms as well. The government has also identified a total of 10 coronavirus hotspots across the country: Nizamuddin and Dilshad Garden in Delhi, Noida and Meerut in Uttar Pradesh, Mumbai and Pune in Maharashtra, Kasaragod and Pathanamthitta in Kerala, and Bhilwara and Ahmedabad as well, and in Rajasthan and Gujarat respectively, are the biggest coronavirus clusters in India. Now, the government has also prepared the strategy after certain cities in India saw a significant rise in the number of cases. The financial capital, Mumbai, has 89 cases out of the 230 patients in Maharashtra. Now, Pune has 42 confirmed coronavirus patients after 2 new cases were reported this morning. 4 patients in Pune are also said to be in a critical condition. Delhi has seen a spike of 24 cases in the last 24 hours, and the total number of cases in India's capital has now risen to 85. Even UP has reported 21 new cases in the last 24 hours, taking the tally to 82. Noida has over 35 cases. And a factory in the city has been declared a cluster with a reported 20 cases after a foreign national visited the factory. Earlier, Meerut too reported 12 new cases. However, the state's principal health secretary maintained that there is no community spread so far. Now, Bhilwara in Rajasthan is another hotspot of concern, as the district has reported 26 cases. Kerala has over 200 cases, while Karnataka has reported over 80 cases. The process of identifying more hotspots will be carried out in all districts where there is a heavy cluster of positive cases. And earlier, the Indian government had dismissed reports saying that there was no decision yet on extending the 21-day quarantine period beyond the 14th of April. Now, strict cluster isolation exercise will be carried out at hotspots to contain the spread of the pandemic.